Hey there, it's Dr. Jared with Movement Theory, Physical Therapy, and Wellness. I wanted to talk to you a little bit about shoulder pain today. We've all had it in our life before. You reach up, you try to grab something out of the fridge, you try to pick up your kids, you feel a sharp stabbing sensation. A lot of times it's in the front, sometimes it's in the back. You don't know what's happening. You think maybe you tore a rotator cuff. You go to your doctor, they do imaging, they give you some painkillers, maybe they give you a few exercises to do, but you don't really find any relief after a couple weeks. You get the report back from the MRI. They tell you have a tear in supraspinatus, they have a tear in infraspinatus, or one of these muscles is torn. But they don't really go into any detail about what that means or how common that even is. And a lot like with the back, rotator cuff tears, degeneration in that shoulder joint, that's all very common, very normal to have, especially if you're over the age of 20 years old. So, if you're 40 years old, 45, 50, you've lived a long life, you've used your body as you should have, you've moved, you stayed active, you're gonna have some degeneration. When it comes to shoulder injuries, there's a lot of things that happen. The shoulder is not a deep socket joint like the hip. The shoulder is a little bit more shallow. It's kind of like a golf ball on a tee. So you've got this shoulder joint here, and then that arm bone is going to be more in like so. The hip socket is going to deeply grab it. You're going to have a labrum around both the hip and the shoulder. So that's one of the similarities of the joints. But in terms of pure depth, the shoulder's a little bit more unstable just from that. And it relies a lot on the rotator cuff muscles to work in sync, to be equal in terms of their pull, because all of those force vectors tend to average out, which creates that suction force of the arm into the shoulder. So if you've got one overactive muscle, a tight muscle, or an underactive muscle even, then you can get some translations while you're moving your arm around that maybe is causing some symptoms, causing some pain, causing some approximation of the bones between the shoulder blade and the actual arm bones. Those issues with the soft tissue where the muscles can become imbalanced. There's also arthritis. You can have inflammatory conditions like that, which may be a surgical candidate. You may end up getting a shoulder replacement just like you would a knee. They have a normal replacement. They also have a reverse replacement, which essentially changes the mechanics a little bit. That would be something you would discuss with your surgeon on, maybe why a reverse would be better than a normal for your daily life. Come to a physical therapist. Our job is conservative care. We tend to find exercises, some stretches, things that you can do at home in your daily life to find relief, keep that relief lasting, and to prevent any symptoms coming back in the future. You go to a radiologist, their job is to take a picture, find something wrong, or at least interpret what that picture shows. Go to a surgeon, their job is to guide you into the best path for your condition. But at the end of the day, they're surgeons, and they're going to want to cut, they're going to want to do what surgeons do. And that's oftentimes not what's best for the patient in that moment. Especially if that pain is chronic, surgery doesn't really show to be a better option than conservative care. And that's exactly why we created these workbooks. We want to give you a free resource, something that you can do at home, something that you can share with your friends and families to help them find relief as well, and so that you can help your, the ones that you love make better informed health decisions about their life as well.